Good afternoon, everybody. As Claudia said, my name is Laura Bright. I'm a manager for data representation and exchange standards with eHealth Ontario in Toronto, Canada. But what I'm going to talk to you about today is our national EHR program that's run by Canada Health Infoway. I'm going to start just a bit with the Canadian context, and I know we're running out of time, so I'll try and be as brief as I can. If I go over things too quickly, please feel free to stop me and ask questions. So Canada has some kind of unique challenges when it comes to the EHR. We are the second largest country in the world, second only to Russia, but when it comes to population density, we are in the bottom 20. Probably 90% of our population lives in those 4 areas of concentration that are listed there. And then we have about 30 million square kilometers of very, very sparsely populated land. We also have a really, really diverse population. It's estimated that Toronto has more languages spoken in it than any other city in the world. That includes London, that includes New York, that includes Rome, Paris. We have about 140 different languages spoken in our city. So the cultural diversity that we have to deal with also is a really big challenge. The healthcare system in Canada is set up as multi-layered governance model. We have the federal government that sets national rules and priorities. But the provincial government and the territorial government, we have 10 provinces, 3 territories, they're in charge of managing, financing, and tracking their own healthcare programs. Within each of those provinces and territories, we have smaller regions that have their own initiatives. We have, over that 30-something million square kilometers, about 700 hospitals and 400,000 physicians, which is a really tiny number for that huge of an area and that size of a population. I'm just gonna... healthcare spending in Canada. These are the most recent numbers we have. You'll notice that they're for years past, but these are the most recent ones I could get my hands on. About $200 billion for 2012. That's about 150 billion euros. 60% of that is for hospitals, drugs, and physicians. And the split is about 70% public or government funding, 30% is individual insurance and private corporations. It's been going up year after year. But the good news is that that growth is actually starting to slow. So you can see it's gone up every year since about 1975. But somewhere around 1995, we hit a real flashpoint and spending started to really go up at an incredible rate. So what happened? Well, probably a lot of the same things that are happening here in Europe. We had a really big increase in the incidence of chronic disease. We had, living next door to the United States, we started to have a really big debate over how much of our healthcare system should be public and how much of it should be private. We started to look at sustainability. We started to have more expensive treatments, more expensive drugs, more drugs. How long could we keep increasing the funding to keep up with that? And then, of course, the biggest one, the population is aging. We hit the baby boomers, the post-war expansion in population all started to hit retirement. They're not being replaced by a younger generation. Senior citizens are going to outnumber children by about 2020. And actually, if it wasn't for that incredible diversity, that incredible immigration that we've seen in the last 25 years, the population of Canada would be declining. So we started about the year 2000, 2001 to look at how we were going to fix that. We started with paper. And in 2001, the government introduced two different initiatives to try and figure out how we were going to solve this problem. The first one was something called the Romanow Report, which was a coast-to-coast survey of Canadians about our healthcare system, what worked, what didn't. Of course, one of the big things we found was silos. We didn't have any kind of interoperability. You can imagine the interoperability challenges when you've got that massive, massive tract of land. Some of the more remote communities are only reachable by seaplanes 6 months of the year. They don't have electricity all the time, much less working HIS systems, hospital information systems, lab systems. They don't have doctors, they don't have nurses. It turns out people don't go to medical school for 7 years so that they can move to Alaska. Who knew? There we go. Okay. So the things that came out of the Romanow report, he came out with about 50 recommendations, but the big ones were, we need to start gathering data. We need to start making that data available. We need to start modernizing the healthcare system. We need to start being more consumer focused. I'm sure these are all very common themes. You've heard them all before. We also looked at what does the population expect of our healthcare system. People were pretty much astonished that their information wasn't mobile. How is it that I can go to Singapore and access my bank account, but I can't go to the hospital the next town over and see my MRI? In this day and age, it seemed completely inexcusable to people. They wanted to be able to communicate with their caregivers. There was a really big concern about privacy, however. Everyone hears about hackers. When you put your information online, everyone is concerned. And then we looked at the level of investment in IT. With all of the other financial pressures involved in the healthcare system, as much as we all knew we should be looking at putting money into IT and modernizing and that would help, with all the other financial pressures, the actual amount being spent on healthcare IT was way, way lower than pretty much any other industry in North America. This also shouldn't be a surprise to anyone. It's obvious that we really need an EHR. For every 1,000 admissions, we had 75 people with an adverse drug event. For every 1,000 lab tests performed, about 150 of them were unnecessary. Clearly, we needed to get this going in order to fix this problem. But as I said, the biggest concern among Canadians that came out of the Romanow report was privacy and security. Turns out everyone gets nervous when that kind of information goes onto a cross-country network. So the second initiative that was put forward in 2001, besides the Romanow report, was Canada Health Infoway. Canada Health Infoway is a federally funded institution. They got about $2 billion in funding in 2001. They're an independent, not-for-profit corporation, and they work together and are accountable to the federal government and the provinces and territories. And their entire mandate is to put together a coast-to-coast EHR. By 2015, they want to have an EHR for every Canadian. To do that, they put together some interesting business strategies. They are collaborators with all of the provinces. Because all of the provinces are responsible for funding their own healthcare systems, there was no way that they could dictate anything to the provinces. So what they did instead was set up a 75-25 partnership. If provinces put together projects that met with Infoway's standards, Infoway would contribute 75% of the money towards the project. So it's kind of a unique model compared to the rest of the world. We have a lot of countries in the world that are being the standards setters, the governors, they set the direction and the standards, and then they don't do much else. At the other end, we have folks like Kaiser Permanente in the US that are the developers. They decide to build their own system. Infoway is sitting kind of in the middle as a strategic investor. They advise, they invest the money, they monitor, but they don't intervene, they don't develop anything, and they definitely don't fund and ignore. Their investment approach was to take these 12 targeted programs to spend that $2.1 billion. The majority of it is on this middle section here, the interoperable health record, registries, drug systems, lab systems, diagnostic imaging. And then the most important part, to my mind, is this bit in the bottom, the infrastructure, architecture, and standards. And I'm going to skip ahead a bit here because this is... Yeah, so the idea was that we wanted to have one health record for every Canadian, including all of those people that are out in the remote communities out in the middle of nowhere. And the way that we decided to do that was to put a very big focus on standards and interoperability and on a standard architecture for the country. So they came up with this. This is the Infoway blueprint. Everyone who works in healthcare IT in Canada is extremely familiar with this picture. It's a very service-oriented architecture. The key to it is the piece in the middle there, what we call the HIAL, Health Information Access Layer, which is a combination of an enterprise service bus and some common services and orchestrations that make all of the, what we call above the HIAL, the data repositories actually work together to provide a unified view of the patient to the point of service applications on the bottom. And every project that Infoway has funded in the last 12 years in Canada has to follow this architecture. So how has it been working? Well, we've had 384 projects across the country in the last 12 years. And about half, about 52% of the population, now has an electronic health record available to their healthcare provider. This is just a map of some of the projects that are going on. We have, in all of the provinces, the non-clinical registries like registries of patients, registries of providers, diagnostic imaging systems, drug information systems, those are available to every province in the country. Some of the more unique ones like healthcare surveillance, consumer health solutions are still being put into place, but they're well on their way in about half of the country.
Can I ask one question?
Of course.
The last slide.
Mm-hmm.
If you look at those colors, is it the same software? Or is it all different software?
Is it the same software? No, it does not have to be. Infoway has some certification programs for certain kinds of software, but as long as you follow the Infoway standards and you follow that general architecture, you can choose whatever software solutions you like that are able to meet that. Okay. So the estimated benefits to the healthcare system. Diagnostic imaging, having a standard diagnostic imaging platform across the country has had some tremendous impact. A little bit less, but still pretty significant, is diagnostic imaging systems, or sorry, drug information systems. The green bar on the top, though, is the one that I find the most fascinating because that's telehealth systems. And those are put in place almost exclusively for those remote communities that I was talking about earlier that don't have doctors, don't have nurses, can't even be reached for 6 months of the year. So the benefit to those communities, considering what a small percentage of our population that is, that's pretty huge. There's, of course, been an impact to the rest of the economic system, not just healthcare. It's estimated that for every dollar that Infoway invests in one of the jurisdictions, the Canadian GDP grows by about $1.48. And that's due to increased employment, decreased time off work and short-term disability leave, increased taxes from people being at work and not being off sick. The benefits are just continuing to grow. So what do our physicians think about all this? There was a Commonwealth survey done a couple of years ago, and they talked to about 2,000 physicians from Canada between March and July of last year, and asked them about their view of the healthcare system in their country and their use of information technology. This is the growth of the use of EHRs from 2006 to 2012. Not as much as we'd like, but still pretty good. We would like to see that obviously much, much higher. Comparison internationally. Canada is still lagging behind an awful lot of the rest of the world, but we've caught up an awful lot in the last 6 years. And we're looking to see that continue. Which one's this? The ability to generate patient information, again, the rest of the world is still fairly much ahead of us, but we're doing much better than we were 6 years ago. So, what are the challenges? Well, we obviously still have a lot of them. Everything always takes longer than we thought. The goal was to have 100% of physicians using an electronic health record by 2015. We're 2 years away from that now, and we're still only at 50%, so we're going to have to do some real work to meet that target. We have a lot slower than expected clinician uptake. That's partly usability of the products that we have available to us, partly some suspicion. Those concerns from patients about privacy and security have been dissuading some physicians from actually taking up EHRs because they don't want their patients to feel uncomfortable with their practice. So we need to address that. Every time there's a privacy and security breach, that there aren't very many of them, but when it does happen, it really, really hurts us. Failure to deliver viable interoperable EHR solutions. Early in Infoway's history, they decided to adopt HL7v3. It hasn't seen the uptake in the vendor community that we would have hoped, and that is obviously hampering our ability to get to full, true interoperability. And because of all these things, we're not seeing the benefits in full that we expected, which of course is not helping with the physician uptake. And of course, skilled human resources, people that truly understand this space, understand the standards, understand the architectures, understand the healthcare system so that they can put together a system that will work for clinicians in very short supply. We could use about 3 times the workforce that we actually have. It's all right, it's my last slide. I don't need to see it. So in short, it's a really promising program. We've gone a long way, but there's still an awful lot of work left to do. But I think the promise of EHRs and of standard-driven implementations is really, really important, and I think it's going to be a good 2 years, 2015.